It's Aaron with Iron Therapy Training, and I have Jason here with Massage at Ease. And we're here inside the studio today. We're going to talk about pain in progress while working out. What pains, are coming up that may be stopping people, or even pains that are happening why people don't even get started in the first place.
Right.
So I'm going to let Jason go ahead and kick it off here a little bit, but what do you feel about the topic today and the pain and progress that we're going to
Well,
talk about?
I mean, to be brutally honest, it's kind of my bread and butter. I mean, this is where my profession lives.
Yeah.
One of my first regular clients, her comment to me was, I was what allowed her to get through her physical therapy so that she could progress and move past the injury she was dealing with.
Yeah.
So this is kind of where I live. And just to field the next spot, pain is your body telling you something. One of the things that Aaron and I were talking about this morning is a lot of people view pain as an immediate stop sign. And then they don't start again, or they don't look at what their triggers are, that what causes this pain, or they don't do anything about it. They take a couple pills and then they don't do any more than they have to. I'm not saying that that's not merited sometimes, but in a lot of cases, it's actually very counterproductive.
Yeah, sure. So a lot of times when people may be struggling with pain, that could be an obstacle that could actually stop somebody from getting started exercising. And like I said earlier at the beginning, that's a lot of the reasons why people stop working out entirely. Like, it'll stop them.
Yeah, they just oh, I had this injury, so obviously I need to never do this again.
Yes.
And pain sucks. Don't get me wrong. Like, pain is awful. I don't like pain. I have pain. Everybody's got pain. And you shouldn't ignore it. But there's always something you can do. You shouldn't ignore it. You should treat it. Okay? And so if your doctor says, well, there's nothing I can do, which they're never going to use those words, okay? That's where you start looking at alternatives. Start figuring out what you can do on your own. And then as you get older, okay, Aaron, how old are you, if you don't mind?
Gosh dang it. Why'd you ask me that question?
Oh, sorry.
38.
He's 38. Okay, I'm 51. He's 38. Do you have any injuries in the past that you still have to deal with?
Oh, yeah.
Yeah.
It's constant.
So do I. I was a nurse's aide before lifting devices were mandatory. So if that gives you any clue about my background. And so you learn where your pain comes from or where your pain came from. And you tune into your body and you figure out, okay, if I do this way, then it hurts. Okay, so we're still going to do this. We're still going to exercise.
Yeah.
We're still going to attempt to progress in our life. But now we know what causes this, we can work around it.
That's good. So exactly what Jason's saying, like, a lot of people will get injured and then they use and sometimes it is an excuse to just stop working out entirely. Now, if you're like seriously injured, of course.
Yeah, go to your doctor.
Go to the doctor, make sure you're okay to exercise, because there are times where, you can't do things. But a lot of times, maybe somebody just has a little bit of a pain in their shoulder or low back pain, and, well, I can't do anything because I'm hurt, I'm injured. Instead of, possibly finding a solution
Right.
for the pain, like
Right.
he was just describing there. So obviously, just taking the pills, like you said earlier, is not going to just fix the problem.
Right.
There's a problem
Right.
deep inside somewhere that needs to be addressed
Right.
to fix that pain. The pills will kind of, eliminate it for that time, a quick fix, kind of, It's going to make the inflammation go down. Sure, you might sleep a little better. You wake up, you're feeling okay for a few
Right.
days,
And
few weeks.
We're not anti-pill. Like, happiness through pharmaceuticals is not something I'm totally against, okay? At the same time, you have to understand that a painkiller isn't treating the pain, it's masking it. It's masking it so that you can go about your day and function. And you should always, when you're talking to your doctor about your pain issues, or you're talking to whatever medical professional you're dealing with, you should attempt to progress. Now, sometimes it's possible, sometimes it's not. Again, that's a conversation to have with your doctor. But in my personal belief, I believe in the unlimited capacity of the human spirit. That's just me. And I believe there's always going to be something you can do so that you're not just sitting around living with it and not doing something to move forward. But
yeah, that's good. And if it's okay, let's talk about the different types of pains.
Yeah.
And I'm going to go into the exercise part here a little bit on the different types of pains. So there's a pain when you're working out that's, an ouch pain. I probably shouldn't do another rep. That would be a bad pain that you want to avoid. Or if you're done bench pressing and you just feel your shoulder killing you, that's a pretty big warning sign that, there's some potential injury ahead coming up. So you just got to watch what you're doing. And then the other type of pain that I like to talk about is kind of like when you're doing some exercise and you got like that, that kind of hurts a little bit, but it feels like I need to do another rep. That's the okay pain that you want to look for. Kind of like flossing your teeth, kind of, it's a thing that needs to be done, and it kind of irritates the gums a little bit.
Yeah.
But it's a good thing to do. It's a good pain you want to chase.
Well, and what you're talking about there, you're going to experience that a lot when you're stretching. You're gonna use a foam roller, or you're gonna get into a stretch, and your body's like, "What the heck are you doing? You haven't moved like this in like 20 years, right?" And then it's a good pain, literally. And as a massage therapist, I hear that all the time. Like, "Oh, that's a good pain." It is. You're stretching something that needs to be stretched, and because it's stiff and it's tight and it's getting in your way.
Yes.
Sorry.
So that's perfectly said right there. Like that, right on the money there. So yeah, these pains that we're talking about, you always got to make sure that you're chasing the right pains. You're not putting yourself in more pain.
Right.
And don't always let pain be a reason not to do anything at all.
Right.
That's basically where we're trying to get to. Like a lot of times, you can still go on a walk and do these things as long as you don't have a serious injury on your leg or something going on. Or you could do, let's say your legs were hurting, you can always do some upper body movements or some core
carefully,
exercises.
cautiously, and let your trainer and your massage therapist know what you're dealing with. Because one of the things that's in our wheelhouse that we train to do, to at least some extent, is what can we do to the shoulder pain when you bench press. Okay, what's your positioning when you're benching? Are you too wide out? Is your grip too wide out? What can we do to allow you to do the exercise to get the benefit without aggravating the injury? And that's more Aaron's wheelhouse, but that is a key component to recovery, to where that shoulder doesn't turn into that chronic issue, where that shoulder doesn't turn into something that now you have to have surgery on and be laid off for 6 weeks to a month or however long the recovery time is.
Sure.
So let us know. We can help. That's part of what we do. Now we're not a physical therapist. We're not a doctor. We're not a pain management specialist. But we have things that we've been trained to do to help you with just about any pain or limitation that you're dealing with, up to the point where we're going to say, you need to go to a doctor, because that's part of being a professional. We're trained to not let you push past what you should be doing. And so communicate, let us know. We can help. Sorry, go ahead.
Yeah. When the number one rule I like to say, when in doubt, refer out.
Yep.
When in doubt, refer out. That's the best method. I think it's a big thing in healthcare,
right?
And anything, like with even all the way down to personal training, massaging, even doctors, they may have to refer out to a specialist or someone who's more certified in that area, or a professional in that area.
Right.
So when in doubt, always refer out. And then with DOMS, like you were saying, the DOMS, that's delayed onset muscle soreness. And one thing to remember with DOMS is chasing soreness after a workout isn't always a good indicator of a good workout. In fact, if you're sore longer for a longer period of time, if you're sore longer than 3 days, I would say 3 to 5 days, then you probably broke down your muscle and body further than what it was able to repair itself in that time. So
in the time frame.
Yes. So that can be a sign, and we talked about that in the last talk about overtraining. So don't always chase muscle soreness as an indicator of a good workout, because it's not true. That's not a good way to gauge your progress. The other thing I was going to talk about was how to track your pain when you're getting out of pain. So let's say a person has back pain.
Pain scales.
Yeah, let's say a person has back pain and they've been in back pain for the last 15, 20 years. And we start doing these exercises and start helping that individual out with some back pain. Nothing major, okay? If you got major things going on, like I said,
go to a doctor.
Go to a doctor, and then they'll refer you to where you need to go. Now, if you're clear for exercise, this is what I'm talking about with the back pain. When you're getting them out of back pain, you want to gauge, how long you're staying out of that pain during the day. So let's say you were in back pain for the last 20 years, and then all of a sudden you started doing these exercises, and you noticed after a couple of weeks of doing these exercises, you only had back pain half a day. It only lasted half a day, and then it started coming back, and then it was in full effect again. And then another couple of weeks or a month later, or so on and so forth, you notice that you made it till 3 p.m. or 5 p.m. without back pain. So that's how you want to gauge progress on pain too. Because if you're so focused on just being in the pain all the time, that's all you're going to remember is how much you're in pain. So you need to track how much you're out of pain.
Right. Well, and that's great approach. The other thing is it's not just an absence of pain. Is it improving? So me, 51, chronic lower back. I'm always going to have it. It's okay. I'm working around it. I'm at a 1. That's where I live. Okay. Pain scale. 1 is I have a little bit of pain. 10 is somebody shoot me kind of pain, and I live at about a 1. So if I do a certain amount of exercises and now it's up to a 3, I have to change that exercise, or I have to put it in a slower rotation to do that exercise. But it's not necessarily just that. My point is, to your point, is it doesn't just go away. It can diminish. It can become more manageable to where, again, we have to be careful what we say, but let's say you are on a pain regimen and you are on 2 prescription painkillers a day to take as needed, which is really common, okay? If you're able to slow down on how often you take that, that is an indicator of progress in what you're doing to treat it. So it's not just about, oh, I don't have pain for 2 days. This is more dealable, or I am able to tolerate this better for longer. In fact, that's a common question that I ask in my practice for returning clients. Like, okay, we've done this, we've done this, we've done this. How long do you feel is the relief lasting? My personal goal for all my clients is to try to get at least 7 days of significant relief. And if we're not achieving that, we're going to alter what we do to try to get that effect. So don't just judge by an absence of pain. Look for, is it reduced? Do I have fewer triggers? Am I taking less medicine? And the other thing is you feed that back to us. Hey, like we did A, B, and C exercise, or we did C, D, and E treatment, and I seem to have longer relief over this amount of time. Good, that lets us know we need to do that again. And then if you're only getting 1 or 2 days relief from something we've done, then we might need to look at another modification or another exercise or the next step so that you can continue to progress and feel better and look better and be better.
Yes, exactly. And with the pain, again, you got to remember, if you're in pain or you're having some things going on, you got to be careful with what you're doing. You have to be careful with what you're doing.
Yeah.
So like if somebody has, let's say they're struggling with sciatica
Common,
And
really common.
a lot of people know that the piriformis is tight when people struggle with sciatica. Now, you got to be careful with what you're doing, because sometimes that piriformis can be so irritated. If, let's say you went to foam roll it and you were sitting on a foam roll, that can cause enough irritation to inflame it more. So you just got to be careful with some of the stuff that you're doing so you don't cause more pain or more inflammation. And then you need to treat not only some of the tight muscles, but the main problem. And for instance, with like sciatica, the problem is going to be in their back.
Right.
It's going to be in their back. Some muscles, deep core muscles that need to be worked on and changed.
Right.
So
yeah, and then there's also daily habits. I talk to a lot of my clients about something I call opening your awareness. So, okay, you have lower back pain. How are you sitting? How are you standing? Do you lock your knees and stand like a pole when you're waiting in line for something? When you're sitting at your desk, are you slouched? Do you cross your legs all the time? What are your body positions? How do you live your life? And does the way you live your life need a few minor corrections that can lead to big dividends in less pain, more mobility, a better life?
yeah, and that's what we're chasing at the end. Is the quality of life, being out of pain, feeling good, enjoying things, being able to do things with your family and kids. That's what it's all about, guys. So remember, it's Aaron and Jason here with Iron Therapy Training. This is our talk today on pain versus progress, or even stopping people from doing anything.
Right.
And give us some takeaways that you got from this video. Drop us a message or a comment or a couple likes. Follow us so you can see more of these talks and hear some more of this information that we're sharing with people.
Right. And we would like a better source than online for what we should talk about next. So it'd be good to hear from some people in the community close to us so that we could talk about things that are relevant that you want to hear about.
There you go. That would help a lot. So,
yeah.
All right, guys. Well, thanks for watching, and we'll see you guys soon.
All right.